Hello and welcome to today's Talk of the Town. I'm Sandy Benson. Low Country Spine and Sport offers comprehensive spine care and sports medicine in a safe and compassionate environment. Dr. John Batson is a fellowship-trained and board-certified physician and joins us today to tell us what's new in the treatment of back pain and sports injuries. Dr. Batson, welcome to the show.
Thank you very much.
So, a lot of athletic people down here, obviously, so I'm sure you see some injuries, especially with, I would think, the spine. So, you know, are all shots the same in the spine?
Well, no, they're not. There are a lot of different structures, obviously, that can hurt in the spine. A lot of people will go through the basic treatments, the therapy, the medicines, the time when they have an injury. But usually when I get involved, it's when those things aren't working and they've had a few weeks of severe pain or a couple months of nagging pain that's just not going away. So the different structures in the spine can cause pain, and that's what we'll direct shots at or injections at or procedures in the spine. There are joints in the spine that allow you to bend, twist, and rotate. Those are called facet joints, just like this is a knee joint.
Okay.
We can direct treatment at any of the facet joints and actually inject the joints that have the arthritis or the sprain. There are also nerves in the spine which help you use your legs. They govern the muscle use in your legs, also help with sensation in the legs. But if you have a herniated disc that pushes on the nerve, that can hurt. Or for some of the older patients that have spinal stenosis that pinches the nerves, that can hurt. For those patients, we do what's called an epidural steroid injection. We actually inject around the nerve, and that's more of a steroid injection, as just putting an anti-inflammatory where the problem is. So one part of the job is finding the problem, and then two, deciding what treatment is going to be best for that particular area. And you've got these joints all the way up the spine, even into the neck. You've got these nerves all the way up in the spine. So there are different areas that can hurt and different procedures for those particular problems.
Okay, great. So what's new for chronic sports injuries like rotator cuff tendonitis, tennis elbow, and I think you probably see a lot of that in this area.
We do. It's kind of some exciting things for those particular problems. In the past, sports medicine has really just been able to do time and therapy for some of these things. Two new procedures that we're offering. One is called Prolotherapy. It stands for proliferative therapy. We actually inject a dextrose solution, just a sugar solution, and it's a mild irritant to the body. So we find a particular problem in the body, such as the rotator cuff that's injured. We inject that area with the dextrose. The dextrose inflames the area and reignites the body's own healing response.
Wow.
Pretty neat.
Yeah, that's really interesting.
Yeah. One of the other new ones that we have is called PRP, and that stands for platelet-rich plasma treatment. What patients do, they come in, we draw their blood. We have a fancy centrifuge machine that we spin their blood in. Gets the platelets out, gets special growth factors out, and if they have minor problems that aren't really needing surgery, but they're nagging pain, such as a minor rotator cuff tear, milder arthritis in the knee, we actually inject the platelets into that particular location. Platelets have a lot of healing properties, and it's using your own body's blood to help heal a particular spot.
Yeah, again, that's an amazing therapy as well. So knee arthritis, again, very common. What are some of the non-surgical treatment options for this? Because I'm sure people, the first thing they think is a knee replacement.
Right. Well, we see a lot of knee arthritis. We do a lot of damage to the knees through our lives, bending, doing a lot of sports injuries, things like that. But some of the treatments that are out there, a lot of studies are showing for women in particular with knee arthritis, if you can keep your quad muscle strong, the muscle of your thigh, that's a great protector for the knee. Two, if you can try to maintain a healthy weight, that's a very important thing as well. So sometimes we work hard with weight loss for patients who need to do that for knee arthritis. If you just lose 1 pound up top, it's like taking 4 pounds of pressure off your knee.
Wow.
Three, there are certain injections that we do for knee arthritis. Some people have heard about getting the coxcomb injections, the rooster comb injections. So that's hyaluronic acid, and that's what your body uses to make cartilage and lubricate the knee. Arthritic knees have less of that in the joint, so we actually supplement the knee with that injection. The other thing would be looking at a patient's x-rays and seeing are there certain areas that we can unload and take pressure off with certain braces. So a lot of times we'll do this along with therapy, getting the muscle stronger, helping them lose weight. and then you have certain backup plans for when you have pain flares.
Right. Dr. Batson, I'm sure our audience has many questions, and I'm sure they can contact you at your office. I'll let you just give us that information.
Sure. It's 300 New River Parkway, Suite 37. Our phone number is 208-2420. We're also on Facebook and Twitter.
Wonderful. Thank you so much. Great information.
Thank you.
And we'll be right back with Talk of the Town.